7 silent signs and symptoms of osteoporosis you cannot ignore. Did you know that currently about 2 million osteoporosis-related fractures occur annually in the United States? These fractures, particularly of the hip and femur, require special care and significantly reduce the quality of life. They result in 432,000 hospital admissions and 180,000 nursing home admissions. Additionally, these fractures contribute to approximately 37,500 deaths each year, often due to complications such as pulmonary embolisms. Regarding hip fractures, about 5% of patients die during hospitalization, 12% within 3 months, and 20% within a year of the fracture, based on data from the United States. Before discussing the symptoms, it's important to recognize osteoporosis as a silent epidemic. Its effect on weakening bones often goes unnoticed until it's too late in many cases. Osteoporosis is characterized by reduced bone mass, leading to weakened bones and a heightened risk of fractures for those affected. The fractures most commonly associated with osteoporosis occur in the spine's vertebrae, the femur, and the wrist bones. These fractures can happen from minor impacts or even spontaneously, without falls or other forms of trauma. Osteoporosis affects 10 million Americans. Additionally, it's estimated that another 48 million may have osteopenia, the initial stage of osteoporosis, putting a total of 53 million Americans at serious risk of fractures. In this video, we will discuss the 7 silent signs and symptoms of osteoporosis that should not be ignored. We'll also address common questions regarding the prevention and treatment of the disease. Be sure to watch until the end, as we will reveal a surprising sign that requires immediate attention, going beyond the usual symptoms associated with physical pain. 1. Back pain and spinal deformity. Osteoporosis can lead to spinal deformities, like kyphosis, commonly known as hunchback. This occurs due to the weakening of the thoracic spine vertebrae, where the front part of the vertebrae becomes thinner, while the back remains relatively intact, leading to a forward-curving posture. Back pain associated with osteoporosis, often due to vertebral fractures, can present as sudden, sharp pain. This pain typically worsens when walking, standing, coughing, or sneezing, and tends to improve when lying down or sitting. Unlike osteoporotic fractures resulting from major traumas like falls or impacts, microfractures can occur during simple movements, such as bending forward or carrying weight. However, due to the disease's underdiagnosis, many elderly individuals may not realize that osteoporosis could be the real cause of their back pain. This lack of awareness is concerning because without proper treatment, osteoporosis can lead to serious complications, including reduced mobility and deformities in body posture. 2. Neck and hip pain. Neck pain in osteoporosis can result from compression fractures in the cervical spine vertebrae. These fractures may pinch or pressure nerves or the spinal cord, leading to additional symptoms like tingling, numbness, or weakness in the arms or hands. Osteoporosis may also cause fractures in the head or neck of the femur, the longest bone in the body, which connects to the pelvic bones. This can lead to hip pain and difficulties in walking, moving the leg, or standing. Symptoms like swelling or bruising in the area are also common. Such fractures are more prevalent in the elderly and are among the most severe consequences of osteoporosis. 3. Decreased grip strength. A decrease in grip strength, which refers to the diminished ability and strength to hold or lift objects with the hands, can be an indicator of the early stages of osteoporosis. This decline in gripping ability is often attributed to the loss of bone mineral density, a hallmark of this condition. 4. Tingling in the legs. Tingling and numbness in the hands, legs, or feet are symptoms that may go unnoticed by those less aware of their body's signals. While these signs are often considered common, especially when sitting in positions that compress the limbs, they can also be indicative of a more serious condition. Specifically, they may be associated with a fracture of the lumbar spine vertebrae, known as a compression fracture. This type of fracture, which can put pressure on the spinal cord or nearby nerves, varies in severity from minor fissures to significant breaks, and is linked to the weakening of bones in osteoporosis. Therefore, it is crucial to be vigilant about these symptoms. 5. Decrease in body height. A decrease in body height is a common consequence of osteoporosis, resulting from the weakening of spinal vertebrae due to reduced bone density. This condition causes the vertebrae to become thinner and more fragile, increasing the risk of compression fractures. These fractures can lead to a noticeable reduction in body height, typically around 2 to 3 centimeters. Before we move on to the last two symptoms, remember to give this video a thumbs up if you're finding the content helpful. Don't forget to subscribe to our channel and turn on notifications to be the first to know when we release new exclusive videos. 6. Chronic pain. Chronic pain, defined as pain that persists for at least 3 months and is not alleviated by standard therapeutic methods, can be a significant consequence of osteoporosis. The postural changes resulting from fractures and microfractures in osteoporosis can impose extra strain on the spine's muscles and ligaments. Many elderly individuals with osteoporosis experience a loss of height, develop a curved posture, and even form humps, making it challenging to maintain a straight spine. This added strain on the back's muscles and ligaments often leads to chronic pain. Furthermore, patients suffering from intense chronic pain are at a higher risk of developing other health issues, such as depression, insomnia, and weight loss. 7. Gum recession. Last but not least, it's important to understand that osteoporosis also impacts oral health, posing risks to the jaw and maxilla. Dental issues including gum recession and more prominent gums are linked to low bone density. In severe cases of osteoporosis, these problems can worsen, compromising tooth fixation, leading to tooth loss or loosening, and making it difficult to fit dentures or implants properly. Furthermore, the weakening of teeth due to bone loss can contribute to periodontal diseases, which may include symptoms like swollen, bleeding gums, bad breath, and oral infections. However, it's worth noting that while cavities are related to overall dental health, they are not typically classified under periodontal diseases. In osteoporosis, the saying, "prevention is better than cure," rings particularly true. Once the bone architecture is damaged by this condition, the changes are nearly irreversible. As the body ages, bones undergo various transformations, becoming more porous and fragile, much like an eggshell. In older age, there's a notable imbalance in bone formation, accompanied by a decrease in calcium concentration. Osteoblasts, the cells responsible for bone formation, slow down metabolically, while osteoclasts, which reabsorb bone tissue, become more active. This imbalance results in increasingly fragile bones. This disease poses a significant concern for postmenopausal women, with 1 in every 3 women over the age of 50 being affected. The absence of estrogen, a hormone crucial for calcium fixation in bones, leads to increased bone fragility in this demographic. What are the risk factors for osteoporosis? Several factors increase the risk of developing osteoporosis, including smoking, a sedentary lifestyle, vitamin D deficiency, inadequate calcium intake, excessive consumption of sodas and coffee, and a family history of the disease. Particularly, excessive alcohol consumption is a significant risk factor, as it is linked to reduced calcium absorption in the body, further exacerbating the risk of bone density loss. How is osteoporosis diagnosed and treated? Recognizing the symptoms of osteoporosis is crucial since the condition often manifests silently. If any of the previously mentioned symptoms are observed, it is essential to seek medical attention immediately. After medical evaluation, the responsible health professional will request necessary tests, such as bone densitometry. This test is crucial as it can identify not only osteoporosis but also its initial stage, osteopenia. It's important to note that an early diagnosis can significantly mitigate the impacts and slow the progression of the disease. Preventive measures against osteoporosis can and should be adopted throughout life, starting in childhood. These include simple habits like regular exposure to the sun for 15 to 30 minutes daily, which is essential for vitamin D production. Vitamin D is crucial for the proper absorption of calcium in the body. The treatment for osteoporosis varies and may involve medications, vitamin supplements, hormonal replacement, among other options. It depends on each patient's specific needs, and only a healthcare professional can recommend the appropriate treatment. How to reduce the risk of osteoporosis? Avoiding foods that hinder calcium absorption is crucial in managing osteoporosis. Such foods include coffee, black tea, salt, and fast food. A proper diet, rich in calcium, includes foods like soy, milk, and its derivatives, dark leafy greens, tofu, and Brazil nuts. Maintaining a routine of light exercises is also important at any stage of life. These activities generate a beneficial impact on the body, helping to stimulate the production of osteoblasts and osteoclasts, the cells responsible for forming bone tissue. Osteoblasts and osteoclasts play a crucial role in synthesizing the organic components of the bone matrix, which is essential for bone remodeling. This process is vital for protecting joints and helping to prevent falls. For elderly individuals, creating a safe home environment is key to minimizing fall risks and reducing the likelihood of fractures. This includes avoiding rugs, especially in the house and bathroom, installing non-slip floors, and placing safety bars where needed. It's critical to seek medical help if symptoms persist for weeks. This is particularly important as these symptoms can be indicative of various health conditions. We hope you found this information helpful. If so, give it a thumbs up and consider sharing this information with your loved ones. Now, we'd like to hear from you. Are you suffering from any of these symptoms of osteoporosis? Let us know in the comments below. Before you leave, I highly recommend you to watch 2 additional videos popping on your screen right now. You will certainly find them interesting too. Thank you for watching. See you in the next video. Bye.